There's been a surge of positive cases in Port St. John's in the Eastern Cape, with reports that most people are fearful of coming forward as they are scared of being hospitalised. A funeral parlour worker was infected while on duty. He's since recovered, but is still being stigmatised. We now speak to the owner of that funeral parlour, Nocawe Makiwane. Nocawe, very good afternoon to you. Thanks for joining us. Welcome to the agenda.
Thank you very much, and thank you for the listeners.
You've had virtual meetings with the government since the incident. Do briefly take us through the conversations that occurred.
Okay, what has happened is that as soon as we heard that the funeral that we conducted in Port St. John's in Majola had some people who tested positive, we immediately got in touch with government. I actually spoke to the MEC of the Eastern Cape, and she gave me the next person and the next person that I could speak to. And immediately after that, then I requested them to come and do the testing into my staff, and they came and they did the testing, and 2 of my staff members tested positive, and since then they were taken to the St. Barnabas Hospital in Gaza, Mthatha, for observation and for quarantining. And since then, one of them has recovered. The second one has just done a second test, which was done on Friday. She's expecting her results tomorrow, and she's in very, very good spirit. And I've had a very big interaction with government since then, not only at the level of the MEC. We actually had in another group of people that I work with, had an interaction with the Minister of COGTA as well, indicating the issues that are facing the funeral industry at large in terms of the challenges on the ground and how we should actually get government to start talking to the funeral industry at large so that we can share ideas and actually get understanding of what is going on as the funeral industry and also as government sharing ideas. And it's got that committee now that has been put together by Minister of COGTA. One leg of it has already happened. The other legs are hoping that they're going to be happening very soon.
So what kind of stigma did you and your staff, affect you? In what way has it affected you? Was it a kind of social stigma, or was it the kind of stigma that affected your business so much so that customers, stay away from your business?
Thank you very much for that question. Indeed. This issue of testing positive, because we went live with it, we went very much into the media. We didn't hide it. There's been a lot of stigma. The stigma, people are running away. They're actually even saying there's corona even follows, and they're pointing it at my employees. As my employees are passing through or even going from work, out of work, they are being pointed, and they are being not only being pointed with fingers, they're being run away from. People that they've always interacted with. So in the heads of people, there's this fear that corona is going to jump from one person to the next person. Assuming that the people are going to be infected by interacting with them, follow the people. Whereas in the case of our company, what we did, we called the health department, and they actually tested everyone, all our branches, all our 18 branches, where all our employees were tested, so that we can find out whether there has been any infections coming from the Port St. John's occurrence. And fortunately, over 100 employees, they were all tested, and only 2, the Port St. John's employees, tested positive. Everybody else has tested negative. So what has actually affected us is that the clients themselves have been scared, because there's this fear about the COVID. But what we did immediately when the government closed our branch, because they closed us the environmental health, we decontaminated the branch and showed them the certificate of decontamination and showed them the videos of decontamination, and henceforth they then opened us. So our branches are opened now, and we've been talking in the media, in the radios and everywhere, telling people that this is not an issue of running away from people. It's a question of saying, is the environment safe? Because the environment, our environment has never been a negative environment, except that it was affected by the fact that we had people who are tested in the premises. So now our premises have been cleaned. We are very cautious of all the rules and regulations and guidelines of the COVID-19. We're telling the clients to social distance. We're sitting there with all the PPEs in terms of the gloves, in terms of the the masks from my employees, and even outside. As people come in, we're checking. So when we do funerals, so that's very, very critical. When we're doing funerals now, we're making sure that our staff are fully geared with everything that they need to do, the disposable overalls, the masks, even the face shields, and the cover shoes. And so they go to funerals with those. But now the new regulation, the new guidelines from the environmental health, because we had a big meeting with the group I work with on last week with the National Environmental Health Director, Mr. Ramatuba. We're now getting the guidance that the people who are handling the casket from you when you're doing the burial must actually be given the PPEs themselves. In other words, they must have the gloves, they must have the masks. So that's what we're preaching to our customers now. And we're doing educating the community to say, community, this thing needs us to understand what is your status. Rather than running away, go and find out in terms of screening. If there's a need for you to be tested, it's going to be determined by the Department of Health people when they meet you. So what we're doing now is to educate people. And in fact, what we're getting through as well is that people, after we did the interviews on the radios and the papers, they are now saying, thank you for educating us. Thank you for telling us what is going on. So Mfolozi Funeral Services has been in the forefront of making sure that people, as much as it was negative at the beginning, we're trying to turn it around, because really, truly, this disease does not have to kill everybody. People will recover. People have got the reason behind. I mean, what has happened for them to have recovered, like my employees, Vuyile, they need to know that story. They need to understand that story. What exactly happened? What have we done? One other major issue is that people must be positive in their minds. We've been preaching that people must be positive. People must also pray. We believe a lot in prayer. So we've been saying, people, you pray, but you don't sit and pray. You sit and find out what's your situation. Where are you at in terms of your status? Whether you've interacted with other people, you've interacted with the people who actually have been tested, especially in Port St. John, and then go and find where are you. So we've been doing that, almost making ourselves some kind of ambassadors in Port St. John to say, people must know that this disease might kill, but it's a question of finding your status very early. So Mfolozi has been in the forefront of that.
And what kind of struggles are funeral parlours facing during this pandemic? I would imagine that the issue of stigma still remains a thorny issue.
Yes. Yes. No, it will definitely remain a thorny issue, the stigma issue. It will remain a thorny issue, but I think it's a question of communicating more and more, educating your clientele more and more, and then also showing what you are doing. When we're doing funerals, now people are looking at us very, very thoroughly, very, very tightly to see what we are doing. They can see that what they are hearing outside, that it must be 50 people who are very strong, strict about that. Only 50 people in the funeral will even take register according to the environmental health and also police on the ground. But what is now critical for the funeral parlours is to keep the guidelines and practice the guidelines. That's the first major thing. But also the other major thing is to make sure that on top of the guidelines, you must be seen to be doing what the guidelines are telling you. In terms of how it affects the business, it's very negative. I must be very honest. What do I mean by negative? I mean that the PPEs, for instance, if I can just point to the PPEs that we must use, they have just come with a huge cost that is just shot up in the hands of the funeral parlour, the funeral industry, without being ready for it. Because we've been using the PPEs all along. They've always been there, part of the regulation, but they were never coming in this volumes. Whereby when you do a pickup in the rural area, your staff must be dressed up in the full PPEs, and when they come back, they must dispose. Because it's disposable stuff. So what has happened now is that the tight corner that the funeral industry finds itself is the fact that the PPEs have come, and they've come with the funeral industry not being ready in terms of funding for that.
And in terms of funding then, has there been any help offered to your staff members? I mean, also with help regarding the scourge of COVID-19 stigmatization?
You mean in terms of my employees having the PPEs using? Or I don't understand the question. Again, please.
Yeah, in terms of being offered PPEs, and with regards to the emotional intelligence that has to be offered to workers.
Thank you very much. I love the term emotional intelligence. Emotional intelligence is the critical part. What have been doing all the time, I do it almost every day. All the time is to motivate myself, but also to almost counsel them. Counseling is a critical part of what you do as a person who runs this business during this era. You need to counsel your staff because they go into other areas and they find very horrible, scary environments. And all what you do is to keep on counseling them and making sure them that emotionally they are strong, but also very strong spiritually. Spiritually, because by virtue of being in this industry, all what we do all the time is to pray. We pray with the families. Normally, when we pick from the beginning, before COVID, our job is to pray, give the family hope, but beyond that, make sure that your staff is strong. Right now, my staff is extremely strong emotionally and emotionally intelligent, because that's what we talk about all the time. Every experience, we share it, we discuss it, we see what is it that we could have done differently. Have we done anything not supposed to be in the right track? If there's anyone of us who have done something somewhere, for instance, where they go and do funerals with the families, are still not wanting to abide by this regulation of saying 50 people in the funeral. Other families are still forcing beyond that. Now, it's a question of how do we handle a situation like that? What do we do on the ground immediately? When we face a situation where the families are still insisting that we want our family, our father to be buried with a decent funeral. According to the definition of decent is to having all the things that people have always used, a big tent and a beautiful decoration, which is quite good historically, but it doesn't apply right now. Right now, we have to say we cannot put tents, we cannot go into a big hall, we cannot go to a church. The service is lasting between 1 and 2 hours. So therefore, people need to be educated more. What is important for us is to talk to our customers and tell them all the time. Those who've spoken to them, they've actually been very good. They've understood the regulations and the laws of the new regulations of the country. Those that have been explained to have actually understood, and they've treated us very well.
You know, Nocawe, you seem to have a very positive mindset amidst this crisis and in terms of dealing with all the stigma that comes with it. Thank you so much for chatting to us this afternoon.
Thank you very much.